This is dispatch. You are going to a 26-year-old male with difficulty breathing.
All right, BSI, is my scene safe?
Your scene is safe.
All right, so based off dispatch, my nature of illness is difficulty breathing. Is this my only patient?
It is.
All right, I'm gonna go ahead and call for ALS ambulance on the way. Based off my patient's signs and stature, I am not going to do any C-spine immobilization. My patient here is a 26-year-old male in the tripod position with clear signs of difficulty breathing. As I walk in, my patient's looking around, he's alert, so I'll give him an A rating for that, and I'm going to determine the chief complaint. Hello sir, my name's Josh. I'm with the ambulance. What was the reason you called us today, sir?
I just am having a hard time breathing.
Hard time breathing? Okay, so I'm going to know any life threats. Do I have any immediate life threats?
None.
Okay. Next, I'm going to go into my ABCs. My airway is open. My patient's talking to me. Breathing, I'm going to go ahead and auscultate. I'm going to go ahead and give a listen. What are my breathing rates? Respiratory rates?
Respiratory rate of 30.
30. Okay. How's the quality? Is it deep, shallow?
Shallow.
Shallow breathing. All right. So I'm based off that listening. I hear a little bit of wheezing, so I'm going to apply oxygen at 15 milliliters per minute. I'm going to attach that through a non-rebreather, and he's hooked up and good to go. Next, I'm going to assess circulation. I'm going to assess the presence of a pulse. Feel here. That's my pulse.
Pulse is 90
Okay.
and regular.
Based off the skin, I can see a little bit of paleness, a little bit of dampness. To the touch, is it warm at all?
Temperature is a little warm.
Temperature is a little warm. All right, so based off this, I'm going to bump my patient to high transport priority. We're gonna package as soon as we go and transport as soon as we can. Next is my history taking. So I'm gonna go onto my OPQRST. How did this begin, sir? Was it a rapid onset or was it slowly over time?
I was just sitting watching TV and I just started struggling to breathe.
Sitting, what, okay. Now, does anything make this worse or better at all, the way you sit?
Just little lean forward like this, that's all.
Okay, the tripod, all right. Now, on a scale of 1 to 10, 1 being you can breathe very easily, and 10 being you can't breathe at all, what would you rate your difficulty breathing?
Maybe a 6.
Maybe a 6, okay. Now, how long ago did this difficulty breathing occur?
Just like 15 minutes ago when I was watching TV.
15 minutes ago, okay. Now that we have our present illness, I'm gonna go ahead onto my sample. So are you allergic to anything, sir?
No.
No allergies whatsoever. Any medications that you're taking?
I take albuterol.
Albuterol, okay. Is there any past medical history relevant to this situation now that I should know about?
I have asthma.
You have asthma? Okay, that's what the albuterol is for, through inhaler. Okay,
Yeah.
perfect. Now, what was your last oral intake in regards to food?
I had lunch about an hour ago.
About an hour ago? Okay, and events, you said you were watching TV about 20 minutes ago? Okay, perfect. So now with that, I'm gonna go into the secondary assessment. I'm gonna go ahead and listen to his lungs again to see if that oxygen has helped with any of the wheezing sounds or his rate at all. What's my new respiratory rate?
Respiratory rate of 20.
20, okay, so that's helped quite a bit. Next, I'm gonna go to vitals just to get a baseline vitals. I'm gonna go ahead and check your pulse again, sir.
Pulse is 90.
Pulse is 90 for baseline. Okay, I'm gonna go ahead and set up my sphygmometer, get a blood pressure. What's my blood pressure?
118 over 82.
118 over 82. All right, and I'm gonna go ahead and listen again, just get a definitive respiratory rate and quality. What's my rate and quality?
Respiratory rate is 20. Quality is good.
Okay. So my field impression of the patient, 26-year-old male, first found in a tripod position with clear difficulty breathing. Applied some oxygen and his signs appear to be getting better, sorry. If he has the albuterol present, I will then help him administer the albuterol through inhaler, and then reassess from there. Every 5 minutes, he's unstable, every 15 minutes for a stable patient. That's not it. I would give a verbal report, accurate report to arriving EMS. Here they come. Hello, how are you? We have a 26-year-old male here who I found in a tripod position, had clear signs of labored breathing. Applied some oxygen at 15 milliliters per minute. His respiratory rate improved greatly from 30 to 20 rates after the oxygen. I also helped him administer albuterol through his inhaler, hopefully to help with that wheezing. He has asthma, and like I mentioned before, he has albuterol prescribed inhaler. And that would be it.